it is particularly for the accredited veterinarians, because in India, the participation of private veterinarians in the private sector is less than 10%, whereas in Europe and all, it is around 60%. And if you see in the USA, around 80% of the accredited veterinarians are engaged in the private sector. So definitely, it's a great opportunity to hear some of the career option in the private sectors. So looking forward to hear from you, Dr. Mrinal Sharma. So I hope this next 1 hour will be enriching for all the participants. Thank you very much.
Thank you very much, sir, for your welcome address, and particularly to Dr. Mrinal Sharma. So now, to give an introductory remark on the presentation and the program, I would like to request our Dean, Dr. Vivekananda Saikia, sir, to kindly give an introductory note. Sir, please.
Thank you. Am I audible?
Yes, sir. Yes, sir.
Good afternoon, everyone. Dr. B.V.Sc A.H, Chairman Training and Placement Cell, Dr. Khanapara Tamuli, Dr. Lima Bora, I could see Dr. Deven Sapota, Professor in the Department of Poultry Science, and Dr. Mrinal Sharma, who will be dealing with the topic today, scope of veterinarians in veterinary science in private sector, and my dear participants, and I could see some others also, those who are joining. So this is a topic where already our chairman, Dr. B.V.Sc A.H, has spoken about the importance of private sector. But being a veterinarian, I would say that the private sector is now the need of the hour, because there is more competition in the private sector, and one has to thrive in private sector. He has to be not only competitive, but also he has to be knowledgeable in his subject. And moreover, the reluctancy that in government service, that after getting a job, that I got a job and now my role is over, as usual, the things are going on. That trend is not here in the private sector. But already in the Western countries and the US, or in some of the Asian countries also, the scope of veterinary sector or veterinarian in private sector is more. And in private sector, what I think that there is a chance to work in cutting edge technology also, and the newer technologies that are being generated in case of vaccine production, in case of your strain development, in case of growth of this veterinary and animal husbandry sector, they contribute a lot. And because if I say in case of poultry sector, if we see that now poultry is an industry and we are competitive enough in our world in poultry sector, our technologies or our growth in poultry sector is enormous, and we are marching ahead. So today the scope and development and scope for the veterinarians in private sector, the topic would deal by Dr. Mrinal Sharma. He is also an alumnus of this institute. I welcome Dr. Mrinal, who was working here very hard during his student days, and also he excelled, or he is doing very good in private sector also. He is now heading the commercial operation Neogen Corporation, and I wish him a very good luck in future also. I hope the topic that is given to him will justify, and also our students, those who are attending this program, they will attract towards to work in private sector, because we must have to attract our students towards private sector also, to know about the rigidity, to know about the firmness, and to know about the competitiveness that can avail in private sector. If one can do with hard work, and one can do with competence, and one can do with determination and dedication in private sector, he will definitely rise up to this desired level of expectation. So with these few words, I welcome Dr. Mrinal, and I hope the topic that is given to him, you will deal with very efficiently in a proper way. I welcome you, Dr. Mrinal. Thank you.
Thank you very much. Thank you.
Thank you, sir. Thank you, sir, very much for the introductory note. And we are really happy to have Dr. Mrinal Sharma with us. He's an alumni of this college, and I'm very happy to introduce him to our students in particular, because we are accustomed and we are known to you, but I'm very happy to give your special introductory note to our students in particular. So to introduce you to the forum, I would like to read out a little talk in brief about Dr. Sharma. So Dr. Sharma is an alumni, as I said, of this College of Veterinary Science, Assam Agricultural University, Khanapara. He joined the college in 1998, and then he graduated in the year 1998. He joined in. And then soon after his completion of B.V.Sc A.H, he had joined M.V.Sc in Pant University of Agriculture and Technology, Pant Nagar in 2000. And the same year, perhaps, he started his career as a research associate in the Department of Anatomy. And then soon after, in 2002, he moved on to Delhi to join in Dabur Ayurved Private Limited as a veterinary scientist. And soon after, he went into so many various positions in the private sector, in the technical services, marketing, sales, and general management in different Indian and, of course, international corporate houses. This includes Ranbaxy, Jubilant, IDEX Laboratories, and currently he is the head in commercial operations of an American multinational company, that is your Neogen Corporation, and based in Kolkata. So Dr. Sharma has a wide experience in veterinary applications, including the herbal veterinary applications, pharmaceuticals, vaccines and biologicals, animal nutrition, and veterinary diagnostics, of course, animal biosecurity, food diagnostics, and many more areas. So we're really happy that he has explored so many areas, and then he has been a part of the biotech startup working on bacteriophage therapy and has good experience on commercialization of laboratory technologies. He has traveled more than 15 countries in the round the globe, and of course, so many places in our own country. So he has he is with his wife and 2 daughters in Kolkata, and his wife happened to be an alumni of this college, Dr. M.V.Sc, and very well placed. And he himself says that he is a foodie and loves good food. And then in his leisure times, he is always inclined towards good music. So Dr. Sharma, I welcome you here, and the forum is all yours, and the students in particular. We'll reserve the presentation for the first part, and then we'll come into the interaction part. If somebody has some queries, we'll take on as such, one by one. So I hand over the forum to you.
Thank you for the wonderful introduction, Dr. Lima. I get confused because my guru in private industry was your sister, Dr. Lima Bora. She was
Thank you so much.
Probably the first daring girl who went out there into the cattle treatment industry, made a place for her, and is still right there at top. Yeah. So with that, I will just like to share my little presentation, and want to begin by thanking the Is my presentation visible now?
Yes, visible.
Yes, Mrinal, it's visible.
Yes. So first of all, I would like to express my thankfulness. I am definitely not the most successful private veterinarian in India. We have doyens in the industry, like our ex-alumni, Dr. Purkasta, who retired as, he is a very senior veterinarian and retired as on the top of the industry lineup as such. Today he stays in Baroda. Probably he's the senior most veterinarian in the private industry from our college. Dr. Lima needs mention out there. Dr. Manavendra Datta, who's working for Subuna right now as a vice president. There are so many of them who are right at the top, but I feel so fortunate today that you have chosen me to take you through this, my experience, or rather the experience of veterinarians in the private sector.
So I just start off with my first slide where I try to rephrase, the scope of veterinary science in private sector. Instead of that, I say prospect for the young veterinarians in the corporate sector. But as the introductory message came from Dr. Debojyoti Dutta sir, he mentioned very important thing out there, that in Europe, 60% of veterinarians work in the private sector. In USA, 80% of them work in the private sector. So I have some slides in which I'm covering what they exactly do out there. And this man's photograph became viral on the World Veterinary Day. If people remember, he is Dr. Albert Bourla, perhaps one of the most powerful people in the corporate world today. He's the CEO of Pfizer. He's a veterinarian. I think he's from Greece, and then he moved on to the USA and is today heading the operations, all commercial and all kind of operations of Pfizer. He's very, very important to the world right now because his company is supplying the COVID vaccine, which is a very hopeful thing for us. And how many people know this person? He's also a veterinarian. He's a very, very strong, strong professional of the Indian corporate sector in the healthcare sector. He's the MD of Dr. Lal's pathology lab, Dr. Om Manchanda. He is basically a vet from Hisar Veterinary College and did his master's degree or his MBA from IIM Ahmedabad before he joined, and he worked in other companies, Hindustan Lever and other companies, and then came on to join Dr. Lal's path lab, which he heads till now. So in my agenda today, I'm going to try and go through the different avatars that the veterinarians take in the private sector. And definitely my first thought that came to me is that when a human doctor graduates, he's not called a human surgeon, but when a veterinarian graduates, he's called a veterinary surgeon. So the practitioner in the veterinary doctor is the first one I'll try to deal with. The animal production manager is the next one, in which I will try to go through the species-wise industries. And then I will come into retail business, because I think these species industries are now getting closer to the customers, and species-wise, these industries, like the food industries, are coming closer to the customers, and a lot of softwares and retail businesses are starting and attracting veterinarians to employment opportunities in those organizations. Then I will try to look at veterinarians in pharmaceuticals and biologicals and healthcare supplies, where I will deal with two different aspects. One definitely is the human health. The other is veterinary animal health. Then higher education, research and development is one other area that I look at the private sector. I think there's a lot of opportunity there too. Animal welfare and wildlife. And then few slides on the keys to success, to being successful in this private sector for veterinarians. So as a veterinary surgeon, the practitioner is the first thing and the easiest thing that a person can start off. And when I go back to what Dr. Datta sir told us at the beginning, I think in European Union and the USA, veterinarians are only known as practitioners. When you say I'm a vet, they actually say, are you a dog vet or a cat vet? So they are into practice in a big way. We in India, we are not that outgoing when it comes to going into practice straight away. We first look for a job if we can. Otherwise, we think that, oh, maybe we'll go for higher studies. But when a vet passes out in these developed countries, the first thing they do is try to get closer to the animals, try to get closer to the animal owners, and then they start off with practice. Of course, they get jobs there in different practices, but they also start their own businesses. And in India also, right now, if you look at the picture on the left side, you have this veterinarian sitting on a table with his chappal, and he's kind of treating this animal. And from there, today, practices have gone on to full-fledged hospitals with operation theaters, with all diagnostics at one floor, places where 25 to 30 animals can be treated at one particular time. Very busy places. So the metamorphosis has happened from clinic, from the clinic to the polyclinic to the hospital. Now, these hospitals also have associated There's one place in Bangalore that I know of called Cessna. His is a three-floor facility, and he, does different things at different floors. He does like grooming and spa, and even an treadmill or exercise center for pets on the top floor, and then he does surgeries on one floor and general treatment in the other. Then people have gone into breeding in a big way. Breeding is also, of course, breeding and that kind of associated activities. There are other people also getting into that business. It's not purely for veterinarians, but clinic, hospital, polyclinic, this is definitely only veterinarians' home ground. Be it a job, you have lots of veterinarians who are also giving practice opportunities to people. Be it a job or your own business, there's a lot of opportunity. Right now, our veterinarians, our college alumni are making a good name in several cities across the country, be it Delhi, Kolkata, Bombay, Bangalore, Chennai, everywhere. So, and I think, and Hyderabad, and probably going forward, people will also keep on moving here. And I have to mention that our veterinarians are also present in the European Union and the American countries like Canada and USA. So alumni of our college are there practicing veterinarians. So there's a lot of opportunity out there. Large animal practice is the other one, mostly cattle, buffaloes, pigs. But there is competition here with the governments veterinarians in government service. So basically a vet to be successful in large animal practice really has to get some specific experience, some good hard work, and learn his trade in such a way that he is a preferred choice, because people have to pay for your services. And then that is when you will be, able to run your own life doing a full-time vet practice. Going from there, we go to, as the veterinarian surgeon, there are other species of animals also. These are like wildlife, zoo and otherwise. But this one requires specific skill. And I think more than skill, the passion for this profession is most important. We have examples from our college. Dr. Kushal Sharma has been awarded the Padma Bhushan Award this year. It's a national honor, and internationally he is known for this. But look at his passion. So it's perhaps this profession of wildlife treatment, wildlife practitioner, is something more dealing with passion, and is probably not a full-time independent profession for many people. But yes, there are veterinarians in the world who are independent professions fully dedicated to wildlife treatment. Unique species, we have a veterinarian in our college, Dr. Dhitul Barman, I think 1 year plus or minus my age. He started his career as a racehorse specialist in Hyderabad race course. Now he teaches medicine in our college, but this is a specialized trade. If you sometimes interact with him and get a chance to talk to him about horses, he will tell you this is not general practice. Sometimes, if there is a special horse, people will pay for a special aircraft to ship in that doctor from a different country to come and treat and leave that country, right? So special passport, special aircraft, everything, just for the vet to come in and take care of a horse and go back. Camel practice is the other thing. It is in parts of Rajasthan, we have veterinarians whom I knew. I haven't been to Rajasthan in a long time now, but I knew there were veterinarians who were specific to camel. Camel diseases are also specific. Camel practice is also regional. In the Middle East, you have a lot of camel practice. And then mountain animals, yak, mithun, mules. These are also a specialized, unique species in which specialized knowledge is required. I cannot say out here that there are jobs or opportunities for these things, but yeah, I can mention that there are veterinarians who specialize in these species and have made a good life for themselves. Now coming to what our Dean Sir had just mentioned, this great industry, poultry industry, which employs so many veterinarians in this country today. Just going through the different sections where people are employed, starting on the right side top, you go to, let's say, the top of the rung operation is always breeding and hatching egg production. Then you have hatcheries, and you have feed production areas, you have broiler production, egg production, and sales and marketing across these different regions. And you also have certain companies who operate across the value chain, right from breeding till selling of the produce. There are companies in India who are doing it. And then you have independent professionals who are into diagnostics and technical consultancy. So diagnostics starts from that picture that I show you, the postmortem examination. So mostly veterinary diagnosis in poultry means good postmortem examination. But a good postmortem examination also needs to be supplemented with proper diagnostic testing. And a lot of consultants are now coming up, setting up their own laboratories. Independent consultancies are coming up in different regions, and these people give very good service to the industry. We have one such enterprise working in the north of India, one of our own, my junior, but most of your students will probably see him in the future as one of the top consultants in North India. And there are these kind of opportunities open to a lot of people. And I think each of these sectors needs specific knowledge and specific exposure. So don't hesitate to start small. That is one message for the people wanting to go into poultry. And I will probably talk about those keys to success towards the end of the presentation also. And imagine this industry, I don't know how the industry people put out these figures, on what basis they calculate it, but they say that the poultry industry is approximately about 2 lakh crore industry today. It's such a huge industry. It supports at least 2,000 veterinarians in the country today. Large animal production industry, this is dairy industry. Again, this is believed to be worth about 7 lakh crore plus. So it's such a huge industry. We are already the #1 milk producer in the world, and we are growing very fast. But the great thing in this industry is that there is so much of scope still open that probably for the next 20 to 25 years, this growth rate is not going to stop. And where do veterinarians fit in out there? On the right side, you see our own alumni. I may not be able to mention so many names, but I like this picture so much. That's why I put him out there. Dr. Pallab Saikia. He was working with Intervet, and then he decided, no, I'm going on with my own venture. He decided to go for consultancy in the large animals, working with large farms and with a goal of delivering 1 calf a year. He did very well, and probably he now stays in Pune and doing quite well for himself. But coming back to the main topic, where do veterinarians fit in the best? Probably right now in the dairy industry, though there are different veterinarians working at different levels. We have one veterinarian here in Kolkata who is working for the procurement of milk for ITC, Dr. Jayanta Hazarika. But more professionals in veterinary science go into the breeding and semen production, AI and embryo transfer area. So that is a very highly specified area. If you look at breed development in India, a lot of private companies from across the world are coming. A lot of companies in India are infusing a lot of technology and money and time on this technology. Today, you have semen worth 1,800 rupees per dose from proven bulls, which are sexed semen. That means using that semen, you have a 90% probability of having a female calf. So that industry definitely employs veterinarians. I have seen at least 10, 15 very good veterinarians who are really deeply into this science, and they're contributing a lot. The other one which has a lot of potential is cattle nutrition. Because I will come to the next slide. In one of my next slides, I will talk about the feed industry. But when you look at the feed industry, I think less than 25% of the feed is really compound feed that is fed to animals. And the veterinarian's role, the cattle nutritionist's role, comes in out there, where he can advise people to really go for the right mix of feed and get the right nutrition or for the cattle to give good production. Dairy products technology, veterinarians are probably coming from master's degree training in LPT, livestock products technology. They are serving in different dairies and trying to get out products or develop and implement technologies and different products for the industry. That is one area, but does not employ too many veterinarians out there. But several managers are working at different levels of big dairy companies. Like, for example, if you look at Amul, we see this is a nationwide huge operations of dairy. So they have veterinarians working with the company at different levels. They have people who are working at the on the AI side with their Sabarmati Gosala dairy farm, bull mother farm, and then from that level till the milk selling level, they have lots of veterinarians across different areas. Milk quality is one area where they employ veterinarians, because today, after the Food Safety Authority has put down its foot saying that no, we are not going to allow milk with less, without proper quality confirmation into the market. After that has happened, a lot of effort is going on to testing milk at the farm level, testing feed at the farm level, and testing milk at the production level. So there are also a lot of veterinarians, and both private farms, cooperatives, everywhere. There are lots of jobs out there to pursue. Again, you will need, I will perhaps in later slides, I will talk about how do you get there and how do you reach to those places. Milk products, sales and marketing, of course, at different levels. Like I said, there are lots of other managers also employed in this industry. Coming to the meat industry, it was surprising when the first time I heard that meat industry in India is 3.5 lakh crore industry, and we are the largest provider of bovine meat. Mostly it is buffalo, but it was something that came to me as a surprise when I first heard about it. But yes, there are lots of abattoirs in different parts of the country where meat production is going on, mostly for export, because again, bovine meat is not really a meat of choice for India. But now chicken processing and also the other species like pork and Chevan processing is also going on in such a big way that probably meat industry is going to double its size in the coming 5 or 7 years. And why will it double? That industry, it's not that it was not there, not that people were not eating meat, but it's just getting organized. And when it is getting organized, the role of the meat inspector becomes excellent opportunity. In fact, if I talk about myself, this was my first dream. I always thought that I should be a meat inspector. I wanted to go to Australia, and I worked with Dr. Mohanlal Brahmo at that time. Brahmo sir wrote a small topic for me, and I had applied for some scholarships where I wanted to go and study about meat science. I also qualified for JRF in meat and animal production technology for the first time, but later on I decided, well, I was not allowed to join that for different reasons. But this is one area where veterinarians fit in very well, be it pre-slaughter or post-slaughter. Quality is very important, and meat inspection is a specialized field only open to veterinarians. Then product innovation and quality control is something which is really coming up very nicely today. There is a lot of concern about speciation of meats. Whether the meat mix that you provide is from a particular species or not is a big concern. People are scared about, and there were stories like in Kolkata, there were stories about dog meat being sold as mutton. So those are the areas where, proper scientific quality control techniques are being used and applied. The company that I work for right now is into food safety, so I know what are the concerns of these companies who are producing meat in large quantities. They are talking about a lot of quality checks in their production chain. And of course, any meat company, if a veterinarian goes out to develop their business, they are seeing better results, definitely, because the veterinarian understands the technology of meat much better than the general food scientists or the general food industry professionals, and he does much better. So now as an opportunity for entrepreneurs also, this is coming up in a very nice way, because a lot of people have started processing in a small scale and started to sell branded, chilled, frozen, and processed meat. So this is something that I think veterinarians could definitely look at as a group of entrepreneurs, as probably working for larger companies or doing their own businesses, right? So then this was the slide I was talking about animal feed, and the picture on the left top shows 15 crore metric tons of feed that is produced in India today. The feed industry is said to be about 2.5 lakh crore industry, but it's only 3 crore of compound feed. So the veterinarian's role comes in out there. If we as veterinarians can make an impact on feed formulation and bring in the awareness about having mixed compound feed to be fed for animals, I think this is an industry to go after. I mean, 12 crore metric tons, 2.5 lakh crores of size, it's something really massive. And the big roles that veterinarians are right now doing is in the field of feed formulation. Feed formulation no longer is a paper pen job. Definitely it goes into a lot of lab analysis. You have to analyze ingredients and get the detailed values, feed it into a computer, and you have these least cost feed formulation softwares, which are very scientific, which help to solve problems definitely at a very nice level. But these are softwares, right? These are run by computers. So you put in garbage, you'll get out garbage, right? So if it's the veterinarian who applies his sense and formulates for the right season and for the right reason, he can really add a lot of value to enterprises in this animal feed sector. So pet food, lab animal feed, aquarium fish feed, these are also something, a big sector. You see, because of our understanding of how much import and export is going on, we see that half of the feed that is being sold in the pet food sector in India is being imported. So there's such a huge opportunity to make these kind of pet foods at home or inside our country, I mean, and sell in that sector. That the opportunity is immense. And of course, you have people who look for veterinarians at the manufacturing and quality control infrastructures of bigger what you call feed companies. Of course, building a feed mill is a little bit expensive nowadays. It's not an opportunity for entrepreneurs, but definitely feed formulation is definitely a very good entrepreneurship opportunity. I have known good formulators who charge about 5,000 to 10,000 rupees per formula, and people come back to them. I mean, once a particular season is there, they go and they use that formulation of feed and they get good returns. After that season is gone, they come back to that veterinarian saying that, sir, this has changed or that has changed. Can you please give me the new formulation? And then you get another 10,000, 15,000 rupees per formula that you make. But you've got to be good. Companies will not spend money on somebody who really does not know the science. So there's a lot of opportunity. And of course, sales and marketing. Today, Dr. Rishi Lake, I don't know whether he has joined the company, the presentation or not. He was looking whether the link is working or not. He was a person who was working for a feed company, so in sales and marketing. And initially, he started in technical services. Because of his skills, the company recognized and pushed him up to the next level. One of our old colleagues, not old, he will get angry if I say old, Dr. Goswami, Deepak Goswami, has been heading this feed business of one of the companies in whole of Northeast India for a long, long time. So there is a lot of opportunity again. Then coming to this retail business. In the last 3 months, I have seen 2 advertisements, one by Licious, one by Big Basket, and the other by Meatigo. These companies are nothing but softwares. They have godowns and they have this wonderful software that connects out to people. They advertise on general media. and they sell meat at great prices. I mean, they're making so much of money, and now these people are going back, looking at veterinarians to add value to their operations. They need a veterinarian to buy the right meat that they want to sell. They need a veterinarian to drive that marketing campaign that they want to sell. They need a veterinarian to oversee the processing, whether the chicken is being slaughtered in the proper way or not. Then some people want to actually open farms, and they're recruiting veterinarians for that. Then quality, standardization, so many other things. And on the right side, I have this picture that shows about, Go Desi milk. This was one opportunity that came up, and I saw this is like a big farm in Pune which sells pure A2 milk directly from a farm, unpasteurized, to consumers in Mumbai, and they charge 120, 130 rupees per liter. So here is a chance for a veterinarian, because it's not milk bought from farmers owning two animals. Here is a sophisticated farm, all operations overseen by veterinarians. When I visited the farm, I saw around 11 veterinarians working there at different levels. Somebody is in quality, somebody is looking at the breeding, somebody is coordinating the AI, somebody is even selling the milk. And I said, why do you take a veterinarian for the sales? We wanted the group to be a techno-commercial group who can add more value. So I think the brand is not Go Desi. The Go Desi is one of the brands. I like the picture, that's why I put it there. But that brand has employed 11 veterinarians in their dairy farm, and they sell milk at 120 rupees to a select market. Those kind of opportunities are also there, where veterinarians are really sought after. Now, that much about production and retail and products side. Now coming to where veterinarians fit in the pharmaceutical industry and biologicals industry. And this slide, I'm trying to cover what little bit I know about the human pharmaceutical industry. So, and in human pharmaceutical industry is getting broken up into human pharma, and then you have something called nutraceuticals, which is a huge area where probiotics and functional molecules are all being promoted, and then you have vaccines and diagnostics. So starting at the first level, the research and development, veterinarians with higher qualifications, probably in R&D, in human pharma R&D, mostly they do not take people who do not have a PhD. So people who have done a PhD, veterinarians are preferred if they have done PhD on a certain disease model, and those people are really welcome into the industry. They are doing well. I think the first and the senior most veterinarian out there in the human pharmaceutical industry was Dr. V.V.Sc A.H from Maharashtra. My own batchmate, Dr. T.K. Burman, has done a lot of phenomenal work for the R&D of Ranbaxy at that time, and now he has moved to the US, but he had done a lot of work in the corporate R&D area. He worked on disease models, and one of his projects was even on silkworm. So they tried to test a disease, a drug molecule on a silkworm as a model for a infection. Then when it comes to veterinary, when it comes to vaccines needs, I think, for the vaccine industry, veterinarians fit in very well, because the kind of training that we as veterinarians receive in microbiology and immunology, almost no other profession can match us, because medical science, they talk about clinical immunology. They do not talk so much about theoretical and molecular immunology as we do. We see a lot of, we have a lot more experience in microbiology also. So veterinary medical doctors, they are not so clear about, on microbiology as much as we are. General microbiologists fall short because they talk more about environmental and general bacteria, more about food side and food contaminants and other bacteria, but definitely on disease-causing bacteria, on disease-causing viruses, disease-causing protozoa, veterinarians are way more, deeply knowledgeable. But again, R&D is something very, very cutting edge for human. So you need to have a good degree from a good institute, only then you can get, or you need to have good networking, then only you can get into R&D at a top pharma company. In clinical development, not much vets are qualified, but they are as qualified as others. So if you are in a pharma company already helping with something, so you may get into the clinical development, clinical trial phases. Like phase 1 is always in animals, so there veterinarians are more part of it. But as it goes into phase 2, phase 3, there are more statisticians and other professionals who are coming in, and medical professionals who are coming in the clinical development side. Manufacturing and supply chain, vaccines manufacturing and drugs manufacturing, all of these are getting a lot more automated right now. So people involvement is a little bit less, but definitely in quality testing, we have alumni from our college who are engaged in quality control departments of top veterinary, top human pharma and top biological companies. And they are doing well for themselves because they now have that much of experience and that much of networking to get them more and more expert into that field. And of course, in the marketing and sales, one thing I want, because now I came into pharmaceuticals, I need to explain this to people that our general understanding is when a person joins a sales department or joins a company to go and promote a product, we say he has joined marketing, but marketing and sales are two completely different things. Again, I remember my early days in the industry, I told people that I'm going to join a company and they say, oh, you're joining marketing. I said, no, I'm joining R&D. But that was also not R&D, it was clinical development. These concepts became clear to me a little bit later. But yes, marketing is more a white-collar job, more a data-driven kind of a job. Sales is the thing that veterinarians can really, really do much better than other professionals when it comes to human pharmaceuticals. Vets with good interpersonal skills stand a much better chance than most other professionals in veterinary sales, in sales field. Why? Because mostly human doctors give good respect to veterinarians, and they understand the science better. They understand the concept of medicines much better, so they can explain things better to doctors. They are very successful when they stick on to that career, but mostly veterinarians don't like to stick on to that career for too long. Those who have stuck on have gone really high. In vaccines, vaccine companies, I think one of our alumni, Dr. Chavi, had worked for a company called Sanofi for a long time in the marketing department. I don't remember too many other people who have really excelled in sales. But yes, that is one field where veterinarians can really do very well. And in the past, there were veterinarians in M.V.Sc who have really contributed very nicely to sales field. But it's highly competitive also. That's something I must say. Now coming to this one, this is our home ground. So human, coming from human to veterinarians in pharmaceutical industry, in the animal pharma, feed additive, vaccines, diagnostics, sales and marketing, everything. So this is our home ground basically. There is competition. There is competition from professionals coming from general field into our vet animal pharma field. A lot is there, but definitely if a veterinarian wants to go and work out there, there are several opportunities. For pharmaceuticals, I must comment out here that not much of R&D activity, true research and development activity happens for the pharmaceutical sector. In the last 20 years, I did not see too many drugs being introduced into the human pharma range. I mean, veterinary pharma range. It's been very copycat style. Somewhere we get information from some foreign country that, okay, this is the new drug, this is the new antibiotic being allowed into animal health. And then you find a vendor and you start doing the formulation and you make it. But it's not real R&D out there. But in the vaccines field, I think vaccine development, there's a lot of opportunities right across the chain, research, clinical development, manufacturing, sales and marketing, technical services, everything. In India, you'll be surprised to know there are 9 companies manufacturing veterinary vaccines. These are companies, by the way, and add to it the another 20 veterinary, government-owned facilities. So probably 29 facilities manufacturing veterinary vaccines for different species of animals exist in India right now. So there's a lot of good research opportunities, and this industry, the veterinary vaccines industry, has delivered some very innovative and beautiful products. I remember in the 90s there was a big IBD outbreak, and the company called Indovax at that time had released the IV95 based hot vaccine for IBD, and probably it was a self-developed doctor. We lost that veterinarian during COVID, but he was the one to kind of get that R&D done, quickly manufacture that vaccine, and he saved crores and crores of rupees for so many farmers across India. So there's opportunity out there in R&D. People need to study the clinical, preclinical, actually paraclinical subjects, because people from microbiology have the best chance in the vaccine industry. People from pathology also do have a good chance in vaccine industry. Then there are also another 10 other companies who are selling vaccines in India. So there are international vaccine companies, do not manufacture in India. Those vaccines are imported and sold in India. So those opportunities are also there. And then clinical development, again, it's a whole, whole home ground for veterinarians. You have lots of studies on regulatory filings, in vitro, in vivo. All these studies are done by veterinarians mostly. There is competition from general, by the way. The general people also keep on coming back into this field and taking positions and contributing in a big way. But veterinarians are on the top of this field. Manufacturing and supply chain, of course, quality control. When it comes, veterinarians are right there. They're doing a lot of work out there. And marketing, sales, especially technical services, no other person can do it. It's only a veterinarian's field out there. Coming to higher education, research and development, the pharmaceutical and biological industry, mostly through, basically this is again very, very highly competitive. But if you do the right kind of study, there are very, very excellent jobs in the pharmaceutical and biologicals industry, in the R&D field. You need to have a PhD. PhD is almost necessary, and you need to have it from a top institute. But veterinarians who have done that have gone a long way in the pharma and biological industry. Those positions are really top of the industry positions, very, very well paid, with all facilities, and you get to interact at the top level in the world. So that option is always open for people who want to go into the pharma and biological industry at R&D level. Then one thing that I've seen that we have missed out on is a good histopathologist. A good histopathologist is a rarity today. I don't see in histopathology has a huge diagnostic potential. Just because there are no people, this science is dying out. If you look at the national, in the US, there is what is called as the NPIP, the National Poultry Improvement Plan. In NPIP, they have a policy for each disease, and the confirmatory diagnosis quite often relies on histopathology. Right now, today, even top companies in India have a lot of molecular biology. You can do a PCR, you can do sequencing, you can do so many other tests, ELISAs and other tests. But histopathology, hardly a few veterinarians in India are giving that service. And nobody is there in the private industry. Private industry, I think only one retired professor in Bangalore still does it. He's in his 80s, and probably when he is done, the science will be done. It's sad, but this is one area that needs some development, needs some focus. People need to think about how much important this science is, and there is a lot of scope out there. I see that. Lab animal science, disease models and their management. So lab animal science, there are the whole array of activities in private institutes. Probably, I could not get data of how many are working in private, how many are working in government. So government, non-government put together, they are in excess of 500. So more than 500 veterinarians are employed in this country as laboratory animal veterinarians. Again, in later slides, I will show you that some networking can help you and get closer to these people. Our alumni people are also there. Like I mentioned, Dr. Tavni Burman was one of the people who was very, very instrumental in this. One of my colleagues from Pantnagar days, he is a vice president in a lab animal company in the US. So and those are opportunities on the top, like, you know, very, very highly paying, very, very respected companies, and open to veterinarians all the time. Then private veterinary institutes. I was very fortunate to have visited the institute. I have a photograph of it on the right side, right bottom. This is GD Deventer in Holland. This is an institute, a private company. I would not call it an institute. It's a private company that serves governments and private farmers in Holland. And this facility, inside it, it has from large animal postmortem till gene sequencing. So if there is a disease problem, a cow dies in a farm, they have their vans, it will bring it in, they'll do gross pathology out there, pick tissues, pick blood, pick samples, take it for microscopic pathology. After microscopy study, they'll go for molecular biology and up to gene sequencing. They do it everything. So this is a private institute, and companies like that will come up in all parts of the world. Somebody has to start it, and somebody needs to go. So small consultants who are doing a little bit of a facility of, let's say, running ELISA, running some aflatoxin test and postmortem, in 10 years' time, those people have gone on and started serving so many other things. So this GD Deventer was also that kind of a veterinarians organization, probably employs about 700 people right now. And these are open for veterinarians who are interested in disease research. I remember there are more colleges in India in the private sector today, but Veterinary College in Jaipur was the first private college, and it's still thriving. This is a higher education opportunity. This is academic opportunity in the private sector. You have it. So if you, and our alumni are working in that college right now also. And there are institutes by these larger companies. Amul has an institute, but it is not really the kind of academic kind of institute that it is. But Venky's and Suguna, these are two top poultry companies who have their own training institutes in which they employ veterinarians to train people into different areas of poultry operations. Going from there, from higher education, I go into animal welfare. Veterinarians, as veterinarians, we really don't like animal welfare, right? So I used to judge animal welfare. Oh, these people have gone crazy there. Come on, welfare. If the animal is not producing, let's kill it. So, but those things are really changing today. Changing preference of human population across the world will make us change our position in this thing, in this area. And the OIE, which is the top organization for veterinarians globally, has set the international standards of animal welfare. So for different species, they are set on different, and a lot of work is still going on. And I think without the involvement of veterinarians and the understanding of the science behind welfare, this field will also get compromised by over-enthusiastic, activists. This is not a field for over-enthusiastic activists. We, as veterinarians, have to get involved in this, look for opportunities, and there are opportunities already in animal welfare departments. Again, they also don't. The animal welfare is also being, overwhelmed by these activists. The activists do not like veterinarians. They say that, oh, the other day only, everybody knows about what happened with the member of parliament scolding a veterinarian. So it's that over-enthusiastic, activist kind of people who are dealing with animal welfare. The science is not understood. So we veterinarians, when we get into this science, this field, it will improve a lot. So I know one of my friends, I don't know whether Dr. Surajit Nath is hearing or not. Dr. Surajit Nath was the first one among us to join Donkey Sanctuary. I think he's still working there. It's a great organization working for the welfare of beasts of burden. And then Brook Hospital is the other one that I remember, where our alumni, Dr. Fareo Zaman, is already there. And Gaushalas coming up all across the country. They will need veterinarians. Without veterinarians, how can a Gaushala keep on functioning? And now with the new slaughter policy and all these things, so veterinarians in animal welfare will probably become a fantastic opportunity for employment for veterinarians in the private sector. Animal welfare through government will never be a sustainable practice. It will always be through private veterinarians that this will become a sustainable practice. Then again, wildlife, like I mentioned, a lot of doyens of this area happen to be from Assam. The two pictures I have put out there of Dr. Mrinal Sharma sir and Dr. Parag Deka Dada, who started the pygmy hog rescue and conservation project. But there are so many other opportunities. Conservation of wildlife is a hot global priority. Everybody wants to do it, and there are lots of organizations across the world who are putting in lots of money in there. This field will grow almost at the same rate as the poultry industry. This field will grow almost at the same rate as the dairy industry, and probably even faster. But again, this is a specialized science, needs deep, passionate involvement, and also a lot of deep study. This is not a joke. These are not animals whose systems we study during our curriculum. So you have to do extra work, you have to do extra studies. But definitely there are jobs out there for veterinarians in the wildlife. So now I come to the final few slides that I want to talk about to the young veterinarians coming into this profession. What happens to us, I think, is the career in the private sector is probably a sigmoidal curve. And you see what happens is that in the initial years, a veterinarian who joins the private sector is placed low down. The reputation of a veterinarian is not really great, except being called a doc sahab and doctor and things like that. Otherwise, they think that, veterinarians are guru doctor and things like that. So they don't take it seriously. So in the beginning, for a veterinarian in the private sector is not very comfortable. And that time is a little bit long. So growing in knowledge in the field and increasing ability to make sense of the information that you get into the field gets you competent enough. So conscious experience is of great value. That's what I write out there on the left. You have to be patient, and you have to consciously go through the experiences, learn from what you are seeing here and there. Once that comes and you gain confidence, your career will rise meteorically. It has happened to almost all the people who are there in the private industry. The beginning years are very tough, very demoralizing. Probably people like us, had we had the opportunity in the government sector, would not have stuck around. It was so demoralizing to be around. But we were very fortunate that we were a group of people pushing each other up during that time. And all the group have risen to very, very nice positions right now. And once that career goes, you will enjoy it. Again, I want to do a little bit of, deeper analysis of that tough period. It's called the Dunning-Kruger effect. And, first of all, you come in there with a lot of enthusiasm and confidence. I know everything. And then you see, look, I'm so stupid because I don't know how private organizations work. Then I said, what will happen to me? I lose all, interest in whatever I'm doing. So it's called the valley of despair out there. And then you gain wisdom, and then your slope of enlightenment happens. The thoughts that go inside your mind is like, I know everything. Then they say, oh, there's more than what I thought. Oh, I'm never going to understand this. Then you start making sense. Then you say, it's complicated, but I'm getting a hang of it. Okay, I will get there. Then after that, you grow. The second very important, that's what is the first most important thing for surviving and growing in the private industry. You need patience. You need to learn constantly and conscious experience. See, some people go through the experience unconsciously. They just get pushed into it and then just get pushed out of it. No, be conscious during that time. Learn whatever you can. Networking is the second big thing. And I've been talking in the earlier slides that I'll tell you later. This is what I wanted to say. If you want to get into laboratory animal practice or laboratory animal science, there is an association called Laboratory Animal Science Association. You are not into professional networking, okay. Everybody is into social networking. So there is a LASA group inside of Facebook. Just apply to enter that and you'll get lots of information. There are jobs coming up, there are new laboratories happening, and so many other things, there are conferences happening, trainings happening that you can learn from. This networking will get you ahead. For the poultry, I was fortunate to get into this Vets in Poultry group. I think it started about 10 years back. Very early I got in, and I saw today it's a group of 500 veterinarians helping each other to grow in this industry. So that networking is something which will really get you on top. For practice, WSAVA is something absolutely crucial. If you are into practice, and that is one field that will absorb more veterinarians than any other field in the coming, let's say, 20 years time in India. For practice, WSAVA is going to be your backbone, going to be where you will learn everything from. And once you get into the industry and go to some level, then you need to go and interact with people like INFA. INFA is the Indian Federation of Animal Health Companies and the CLAFMA of India, let's say. These were opportunities where jobs are found, people find each other, and they give jobs and opportunities to people. So networking is very, very key to success in the private industry. And the third one is, of course, the most important one, is communication. Knowing is not enough. Know well and explain simply. And Einstein said it very nicely. If you can't explain it simply, you haven't yet understood it enough, right? So if you haven't understood, how will you explain easily? So work hard, learn things properly, and learn how to say it simply. That communication is that art of communication is a language of leadership, they say. And this is one thing, two things that I advise to all people whom I work with in my day-to-day affair. I say, do not judge. First of all, do not judge. When you hear something, don't make a judgment and start blabbering out things from your mouth. So there are two-way communication. Communication is always two-way. God has given you 2 eyes, 2 ears, and just 1 mouth. Use these organs in that ratio. So listen 4 times, speak only once. Then you have got the ingredients of success in the private industry. So the opportunities have been captured, and this small little message for the young veterinarians who want to do well out there. If you have any other questions, thank you for your attention. I'm available now. Thank you.
I think we can take on some queries. Participants, if you want to ask anything from Dr. Sharma, you are welcome to do that. Dr. Shantanu, is there any message or in the chat box?
No, there is no message till now.
Okay.
You can wait for sometimes. I think students can either turn on their microphone and ask the question, or otherwise they can write it in the chat box also.
Yes. Because Dr. Sharma has very beautifully depicted the entire, I think, the private sector so elaborately and I think he has not left any area untouched, more or less. And
Yeah,
it's
so
really
I think one question is there.
yeah, one question is there.
Sir, export opportunities.
Export opportunities. Yes.
That is a very very nice question, Dr. Rajsekhar Sapkotas. So basically, for exports, you need to know what you need to. First of all, like exports, if you are asking about opportunities to export things from India, you need to have a company that is ready from the infrastructure wise. You have to register a company, have it registered with the Director General of Foreign Trade, have a bank account which supports your international financial transactions, and then select what you want to export and find the channels. And today's, through the networking, it is very easy, but you have to have these basic things like opening up the firm and having the right licenses. DGFT gives some licenses out there. Again, if you're talking about whether organizations where you can work, almost every animal health company has an export department. They keep on advertising positions or taking positions from here and there. So those opportunities, again, through networking could be found out. Okay, I see some more questions. Can I take them directly one by one?
Yeah.
So I say, Bikash Pandey, why Northeast India is lacking in such private venture? Because you seldom heard about any big private players here in Northeast. Dr. Vikas, I think it's not true. If you look at every big company is present in Northeast. You have in poultry side, you have, Suguna is there, Venkateshwara Hatcheries is there, Premium Chicks Feed, Karkeshwara Hatcheries, you name it, there are at least 6 top firms on the poultry side out there. In dairy, we are lagging behind. We lag behind because of probably the amount of promotion that we have done, and the market is controlled in a different way or plays in a different way. Pharmaceutical company, almost every pharmaceutical company has a representative in Northeast. Yeah, the market being small is one of the biggest reasons why you don't have a big presence in those in the Northeast area. Then comes Abhilasha Sharma. First of all, information, thank you very much. People have always talked about destinations, but no one has showed where to start the road. I really appreciate it. Oh, thank you. Thank you very much. Pritika Chankapati, sir, can you about your work on bacteriophage therapy? Very interesting topic. I can speak on hours together on this one. It started way back in 2005 or 6 when a company called Ganga Jain was in Bangalore, and I approached them to bring in that technology in a collaboration with M.V.Sc. I worked with them to develop the first bacteriophage product in India, which was a Salmonella bacteriophage that we developed for that company. Later on, we could not commercialize because the right price point was not there. Further, I kept on working with them, and when I moved from Delhi to Bangalore, I started a small company myself. It's not really a commercial entity even now, but it's like a passion. It's like a hobby. So I've been working with this different companies in the fermentation area who can help us to develop these bacteriophages. There are different sources where we can get them, and right now I think we are at a stage where I have to mention out here that I actually signed an agreement with the university, and we have actually paid some money as a research project to the university. Some work is going on in the Department of Microbiology for isolating certain very good bacteriophages. Once that comes up, I think we will have a nice story on bacteriophages starting at AAU Khanapara. And then Dr. Rajsekhar Sapkota asked, what products in the whole veterinary sector hold a great export market potential? Veterinary products, veterinary pharmaceuticals, definitely true. A lot of companies are exporting pharmaceuticals. Easiest way to start off is with feed additives. Feed additives do not need licenses to manufacture, do not need much of licenses to export. Feed additives is probably the best starting point, the easiest starting point. And start close. If you are really interested in doing your own work, then start close by. Start in Sri Lanka, Bangladesh, Nepal. There are good markets out there where you can easily supply products. I think you can start off out there. Dr. Dhrupal Patel, sir, please talk about scope after M.V.Sc in gynecology. Dairy industry is open. Semen industry is open. There are opportunities there. If you let me, or if you connect to me at a later time, I will even guide you to some of the top semen companies. I am connected to few of them. BAIF, the Bharat Agro-Industrial Foundation in Pune, they have tied up with a company called Cemex of the US, and they are doing sex semen. They produce about 1 crore dose of semen every year. So that's a fantastic place to start. I know some people there and probably can help you. I also know the people at Genex Breeding. Genex Breeding is another company based out of Pune, but they have facilities in Uttarakhand and Pune. And also some of our veterinarians in the state veterinary services in Uttarakhand. Dr. Brijesh can really help. It's a very nice starting point. And then the photograph that I shared with you, Dr. Pallab Sakya, you should find out his contact from Facebook. Contact Pallab Sakya. He's a gynecologist himself. So he started off with that project with one calf a year project. He will definitely be of a lot of help for you for gynecology. How much can, and Dr. Angad Singh is asked, sir, how much can having an MBA degree help us in private sector? Obviously, it's of prime importance, but don't think that degree will get you there. First of all, you need to have that. First of all, you need to get that job and have the attitude to go through the grind. I think it's a better idea that you don't pursue the MBA straight away. Join a job. After a few years experience, go for a shorter version of the MBA, which many of us have done. I haven't personally, but many of our seniors have also done. Dr. Lina Bora has done from, I think, IMT Ghaziabad. Dr. Paran Sharma has done from IIM Indore, and a lot of others. I think almost everybody has done an MBA. But don't start off and think that getting that MBA will get you a job. Get into the job and look at an MBA after some time. That will be much better. Dr. B. Mohanty says, does private company provide training in lab animal breeding and science in India? I don't know if they provide training, but yes, the National Institute of Nutrition does have a premier livestock lab animal breeding center at Hyderabad. They run some of these trainings. A private company does not help, but I don't think, private companies do not do this training. The NIN Hyderabad is the top place you should go to. I think the NIANP in Bangalore, the National Institute for Animal Nutrition and Physiology at Bangalore, they have also invested in a big way in a lab animal facility. So there are our alumni, Dr. Anjumani Mesh is there in that institute. She can probably guide you in understanding who can help us do any training out there. But yeah, I think the prime one that you should look at for lab animal breeding and lab animal training, you should look at NIN Hyderabad, National Institute of Nutrition. And Dr. Mang Seng Chaupu, what kind of skill does a company look for while appointing a meat inspector? Well, no skills. You need to first see that you get the right contact and apply. Probably just being a veterinarian is good enough for meat inspector's job. These are not jobs that people are running after. These are probably easily available. You just need to have the good contacts out there. Dr. Rupjyoti Datta, sir, I am currently doing PhD in animal nutrition. So I would like to know some job aspects of it. So feed industry is there. Feed industry is open to this, and poultry integrations. All operations in technical service in poultry integration companies are open to animal nutritionists. You have Dr. Rishi Lake, who is now working with Jaffa, can guide you a lot. My own batchmate, Dr. Dr. Sakia is also there, and probably there are so many of them in the in the poultry. Okay, Dr. Abhilash sir, what about veterinarians as epidemiologists? Okay, what else? I missed on Dr. Jason, my view. Sir, please give some information for veterinarians in international NGOs or organizations. Again, networking is very key in this one. If you are on social network, just get get into those as groups. If you look at Facebook also, they have groups. So on NGOs, you connect to those groups and also connect with these veterinarians. These few veterinarians who are there in Guwahati itself, I think SOS. Wildlife SOS has an employee in Guwahati. Connect with those people and then you will get to know about these. What about veterinarians as epidemiologists? Epidemiology as a field is not understood by veterinary community in the private industry at least. They don't understand epidemiology. Sorry. So epidemiology still remains with the government agencies to a great extent. So in terms of epidemiology, we are just into animal disease diagnosis. That's all we do in epidemiology. Government agencies like, ICAR, there is one institute in Bangalore called NIVEDI, National Institute for Veterinary Epidemiology and Disease Investigation. So that, it used to be called something else earlier. Now it's called NIVEDI. So Dr. Rahman is our professor. Dr. Habibur Rahman sir was director for that institute. That is the top institute that does it. But again, it's not well understood. Frankly speaking, epidemiology is not well understood. Again, it's a thing that is to be thought about. How epidemiologist brings his skills into the private industry. Probably you can get into diagnostics. That will help you a lot. Kritika Chankakoti, Dr. Kritika Chankakoti, how do we pursue wildlife veterinary after graduation? Again, I said earlier, it's like the same thing as the NGOs. You've got to network, you've got to talk to people and study and follow some people and get communicating with people. That is how you will enter. Of course, these jobs are also advertised sometimes. If you follow these organizations, you will get to know their advertisements. Dr. Thiam Ramesh Singh. So what would be the scope of veterinary medicine and R&D and vaccine development? For veterinary medicine in vaccine development, probably if you have worked on a infectious disease, it would be very easy to pick up from that research project that you have done in your M.V.Sc and then go into R&D. Again, I think it's not the top subject for vaccine development work. Microbiologists and pathologists are the ones that are preferred in that industry. But of course, if you have done microbiology work in your master's degree, you can use that thesis, contact these companies and get there. Dr. Sharad Das says, is it the right choice to do any private job in a contractual basis? I think all private jobs are contractual. So there is nothing called a permanent job. Even I, being the head of operations out here, I'm on a contract. So there's nothing like a contractual private job. All private jobs are basically contractual. Till the time you keep on adding value, they will like you. It's like that. Dr. Pavitra Bortamoli, I have seen pork price in Southeast Asian countries like 2000. Sir, is it possible? Definitely it's possible to export. You need to have the right licenses. My wife, Dr. Jimdi Sharma, she's also an alumni of here. So she is the veterinary quarantine officer from Government of India. So they deal with all these companies who get licenses. So basically, you have to have the DGFT license, the Director General of Foreign Trade. They will give you an import-export code, and then you have to get the requirements for importing pork into that country from that country. So you have to find a buyer for pork in that country and get to know what requirements they have. According to that, you have to work with the Indian agencies. Say you have to go to the trade department at the Animal Husbandry Ministry, Government of India, and they will give you the sanitary import-export guidelines. So then, according to that, you have to prepare your product. The product has to be free from certain diseases. The product has to have certain quality compliances. Your facility has to be inspected. Then there is also two agencies which are very important out here. One is called EIC, Export Inspection Agency, and the EIC, and the MPEDA, Meat Product Export Development Authority. So the MPEDA people will come and check your facility and say it's good for export. EIC people will come and check your facility, give you the certification on the basis of what is required in the importing country. So the requirement of the importing country has to be complied. Your product may be very good for India, may be completely useless for that country. So you need to find out a good buyer and the requirements from that country. MPEDA, EIC, DGFT, veterinary quarantine. All these things, if you put it together, it should be a good business for you. Dr. Dhrupal Patel. Sir, is there any Ayurvedic ethnovet training or master or certificate course if available? No. Frankly speaking, there is nothing available. There is one veterinarian at NDDB, National Dairy Development Board, Dr. Pankaj Datta, who has been running that program. I think he spoke in our college at one occasion, and he talked about ethno-veterinary practices in veterinary practice in large animals. So Dr. Pankaj is a great resource. If you can connect to him and find out, he will be able to give you much more because he has been working on this field for quite a long time now. But no ethno-veterinary training is really available. No certificate course is available. I'm Dr. Rajseka Sapra. I'm doing M.V.Sc degree, really compulsory for success in private sector. It definitely helps. An M.V.Sc degree definitely helps. At any point of time, if you have an M.V.Sc degree, and the right degree, of course. I mean, Dr. Manoranjan Sharma is asking satisfaction level in private job. I'll tell you in private. This is not. Of course, I love it. I mean, I cannot imagine that I could have had this kind of a life at all if it was not in the private. I remember the first time I had my international trip, I went to Rangoon. And when the flight got down, I was so scared because there were people in Ganji and Lungi with an M16 gun and a broken bus took us to the airport. I said, what is this that I've seen? And from there to going to the USA and having a 10-year visa for multiple entries into USA. All these things are really, really very, very cool to do. It's been amazing.
I think no question is coming now.
Yes,
Okay, but that was a nice interaction actually. So many queries, and I must say you have really attended well.
Yeah, 78 people till the end of 1.5 hours.
Yeah, actually, Mrinal, we had some issues today. Otherwise, we actually can incorporate more than 200 people, but today it was restricted to 100 people. And so many people were texting us that we're not able to get in. But anyway, we're going to get the recorded one to them. So one more question is there. Is it so? Sulabh Chetia, top 3 qualities you suggest for being in private sector by young veterinarians?
Again, I already said about those that I rank on top. Number 1 is networking. Number 2 is being communicative. And number 3 is being patient. You'll be successful, Dr. Sulabh. You're already so successful.
Debojyoti Datta sir, shall we wait for some time or we will conclude it?
Definitely, it's indeed a great interaction. Particularly, he shared his vast experience and these opportunities and career options in these private sectors. It's tremendous. Thanks, Mrinal, for associating with us. So definitely we'll do more on this. And one of the fine interaction is that already we are trying to all about this export and EPIDA. Already I talked with one of the persons. So he already said that yes, we'll give a presentation on this. And that's the motivating our graduate in respect for this role of veterinarian, particularly in meat industry, dairy industry, and animal feed industry, is very encouraging and enriching. Actually, it's very enriching. So definitely, it will help our participants. So our participants are asking many questions. They are actually they are very competitive. So they are very competitive. They want to. Yes, that's definitely the more interaction, their participants will definitely, in the days to come, will definitely make you a fantastic, highly competitive, accredited veterinarian. That definitely we can say from our training and placement cell. So maybe someone is asking some query from the participants.
No, they are all thanking, sir.
Oh, Mrinal, thank you very much. Nice, very nice presentation. Though you have exceeded half an hour, but we are still gluing to you.
It's an honor. Thank you very much, sir.
And varieties and all students, I think we have satisfied all the students their queries. Very nice.
I tried my best.
Thank you.
So when I think no question is pouring in, so we will come to the concluding part of this particular online session. And it's been so exhaustively presented and so well attended to all the queries that literally we don't have much to say at the end. But then to the students, I'll say something, and to Mrinal also, that your presentation covering all aspects in the private sector, of course, other than private also, you gave lots of inputs into it, which might be very motivating for our students. And particularly this training and placement cell in our college are targeting to motivate people so that they just don't rely on the government sector to provide them job and have a very comfortable lifestyle. From your presentation, it was quite clear that what patience and being conscious and proceed with what you know and built upon what is actually in the market is very important for them to grow. And of course, in our one previous session, which was some 2 weeks back, we had people and how to face an interview and all. There also they had said that the social presence, social media presence and tagging, networking, they had talked about that, and the way of communication, which you have said. And we have been in our regular classes also, we have been very stressing on this, that networking, social presence, and your communication is very important to thrive in the private sector. And I think you have really done justice to this. And we are extremely grateful, particularly from the training and placement cell, for you for giving so much of time, almost 1.5 hours here in this forum. And we really loved you. Listening to you, your words, your presentations, your attending to the queries, no words for that. And being you're my junior, of course, and I have always been in cordial relation with you and hope to see you again in this kind of forums again. Thank you so much. And coming to the formal vote of thanks, first of all, thank you again for your giving us time. And we are extremely grateful to our chairman of this training and placement cell, Dr. Debojyoti Datta sir, who has been always there supporting and guiding us for organizing such type of programs. And our dean sir, Dr. B.V.Sc A.H sir, who has always encouraged us to go for organizing this type of sessions so that our students stay motivated and get themselves engaged in so many sectors, call it private, call it public, call it NGOs or any other associations, organizations of their own. And coming up with startups and all also, we are trying to tag in people so that they can elaborate on those. And we are extremely grateful to Dr. Shantanu Tamuli, Dr. Himanshu Barua, and all those people who are in the placement cell, because they have been always putting their time, their effort, so that our budding veterinarians from College of Veterinary Science can shine in the future. So I thank everybody who's here in this forum today, particularly the participants. I hope you will take back home some motivations, which is very much essential. And of course, I'd like to stress here, please learn from your speakers the way they communicate, their gesture, their expectations, their satisfaction, what they don't say in between the lines. You try to grab that and take home the motivated spirit and come up with your own career in future. Thank you. Thank you, everybody. Thank you, sir.
Thank you. Thank you. Thank you. Thank you. Thank you very much, everybody.
Yes.
Okay. So we'll leave then.
Yeah.
Yes.
Thank you
Yes,
very much,
Dr.
Mrinal.
Okay. Thank you.
I could see so many others alumni also in this. I could see Manoranjan and I could see so a big hi and namaste to all of you.
So Mrinal, can you share your email ID so that if somebody want to get more information in future,
Sure.
they can contact you?
Sure. Sure. I'm just typing my email ID right here, but everybody can reach me on social media. I'm on Facebook, LinkedIn. So from there we'll take it. Yeah, I'm typing my mail ID out here.
Yes.
Okay then. Thank you very much.
Yeah.
It was so enriching for me also.
Okay.
Thank you so much, Mrinal. Thank you. It was very marvelous presentation.
Thank you, Himanshu. It's all your inspiration. Thank you.
Thank you.
Thank you.
Everyone.
Thank you
Thank
very
you,
much.
Shantanu. Thank you, Himanshu.
Thank you.
Thank you. Thank you.
Yeah.